This video is intended for educational purposes only and does not replace a formal occupational therapy driving assessment.
Hi, my name's Laura and I'm one of the directors of Institute of Driver Health and I'm an occupational therapy driver assessor. Today we're going to talk about what an occupational therapy driving assessment actually is. So an individual is often referred to an occupational therapist for a driving assessment when a medical condition is identified that may impact their driving ability. So this may include conditions like dementia, a stroke, brain injury, neurological conditions, physical disabilities, and even neurodiversity. The occupational therapist that undertakes these assessments has completed additional postgraduate training in driving assessment and rehabilitation. And this specialist OT's role is to assess whether the person can drive safely and independently and whether any supports or modifications are required. So the first stage of the assessment process is a pre-drive assessment, and that's where we are looking at understanding the client's medical history, including their medications, their diagnosis, and what that means for them, the symptoms that they experience. We complete a visual and perceptual screening test, looking at their visual acuity, their scanning, their spatial awareness, and the perceptual skills required for driving. We assess cognitive function, including attention, memory, processing speed, judgment, insight, just to name a few. And we also look at their physical function, assessing their movement, their strength, their coordination. All of these screening tests allow us to determine what might impact a person's driving, so that then we can target the next stage of the assessment to address any potential issues. The second stage is a practical driving evaluation completed in a dual-controlled vehicle alongside a qualified and specially trained driving instructor. This is undertaken on actual roads for a minimum of 45 minutes. During the on-road assessment, the occupational therapist observes how the individual's condition and the deficits that were identified in the pre-drive assessment impacts their actual driving performance in terms of their observation of the driving environment, including, for example, scanning appropriately at intersections, noticing and responding to hazards, road signs and other vehicles and pedestrians, their ability to maintain appropriate speed control in relation to the regulatory speed limit and the conditions, their planning and judgment, for example, determining who has right-of-way at intersections or choosing an appropriate gap, their vehicle positioning on both marked and unmarked roads, including not only lane position but also distance from other vehicles and objects in the driving environment. Their physical control of the vehicle, whether they can competently operate the brake, the accelerator, the steering, the gear shift, indicators and other controls to maintain physical control of the vehicle. Feedback is often provided during the assessment, allowing the individual a chance to improve their performance where required, and that also forms part of the assessment. The role of the driving instructor is to determine the route and to maintain safety and support the occupational therapist. The decision about the impact of the medical condition on driving lies solely with the occupational therapist. Following completion of both the pre-drive and the on-road assessments, the occupational therapist provides recommendations around driving. In some states, these recommendations go to the doctor for them to make a decision about fitness to drive. In others, they go straight to the licence authority. These recommendations may include that the medical condition doesn't impact driving performance and they can continue or return to driving with no restriction. Or the medical condition impacts physical control of the vehicle, but with vehicle modifications or adaptive equipment, the person is still a candidate for driving. In this case, lessons would be required, and these will be directed by the occupational therapist and carried out by a driving instructor with specialist training, expertise and experience in this area. Occasionally, the medical condition may impact the driver, but certain conditions may reduce the risk, for example, restricting them to driving within their local area only. Finally, the medical condition may impact driving where they are no longer safe. and lessons will not be beneficial. In this case, we would recommend that the individual stop driving. In all of these assessments, the overall goal is to support the individual's driving independence while also ensuring safety for that individual and for the wider community.